Hi, good evening, Steve Adler. Got a minute? All right, we're gonna stay pretty close to just the numbers here tonight, talking about COVID, answering a few questions that more than one person has sent in. But we're going to start as we do with the dashboards. Tonight's dashboard. Look at the numbers to the left in orange. We look at hospitalizations. That's where we key because it's data, unlike cases, and we'll talk about this later. Cases could vary for lots of different reasons. They did tonight as well. But let's look at hospitalizations at 57. 57 is below our 7-day average, which itself has dropped to 63.4. Look at the graph in the middle, and you'll see that we were on that really sharp incline, and now we've kind of leveled off. Maybe a hint that the numbers are doing more than leveling off and coming back down. Those numbers are great. They also scare me because there hasn't been a city in the country, best as I can tell, that has actually had a peak and had it come down and then managed it coming down well. I was looking at Los Angeles here. Los Angeles had a peak. They came down. They started opening up their economy. People started relaxing, not treating the opening of the economy carefully the way you need to. And now there are discussions in LA about having to do a second close down, shutdown. That's what we were talking about as we had that incline. There has to be a city that can figure out how it is that you responsibly deal with a decrease so that you can sustain businesses, so that you can sustain schools. We'll talk about that later. That is our big challenge. But our numbers, again, flattening out, maybe even getting a hint of going down. On the right side of the page, it's the numbers in new cases, up 603. We were at 145 yesterday. I said funny things happen on weekends. Sometimes it's best to, well, it's always best to look at the 7-day running average. But even in the last 2 days, with 603 today, 145 yesterday, that's about 375 average over the last 2 days. You can see our 7-day number is 342.3. The 7-day number for hospitalizations is 475. The number of people that are in our hospitals tonight, 459, which means that we are now below our 7-day running average for people who are actually census sleeping tonight in our hotels. ICUs, 155 people sleeping tonight in our intensive care units with COVID. That compares to, that's the 7-day running average. The actual number of people in our hospital tonight, 153. So again, the number of people we have in ICUs tonight, lower than our 7-day running average. People on ventilators, our 7-day running average, you can see is 104. The number of people we have on ventilators tonight, 106. So that number is just barely above our 7-day average. Those numbers are all real encouraging, as is the doubling time at 45.5. You recall it wasn't but 2-3 weeks ago when we were actually getting down into the mid-teens from a doubling average. Let's go to the next dashboard. Both of these dashboards, by the way, are on the City of Austin website. The numbers in green in the middle are tonight's numbers with hospitalizations, ICUs, and ventilators that I gave you just a moment ago. The number of cases with the 603 takes us up to 18,394 cases. Number of people passed away, that's the orange number, 218. That's 9 more people than we had pass away yesterday. In the last 3 weeks, we have suffered about 1/3 of the total number of people that have passed away from COVID from the beginning. About 1/3 of them, or just under 1/3 of them, have died in the last 3 weeks. That's what happens when you have a peak like we saw, where more people get infected. If more people get infected, more people go to the hospital, ICUs, ventilators, more people die. All right, those are the dashboards. Let's take a look at the website for Dr. Myers. I want to touch base on that again. You can get to this yourself. It's publicly facing. You can see that the reproduction number is down to 0.78. That's the R dot number. If we're at 1, that means everybody who has the infection, odds are they're going to give it to one other person. If you drop below 1, or passing of the virus, theoretically, with each round, fewer people have it. Eventually, the virus gets to very small numbers. If you're over 1, that means every time there's a new generation, more people have it, and it's going to continue to grow. 0.78 is a number that's gone down. The probability that the epidemic is growing, we were at 22%. Here recently, we are down to 9%. That's how we kind of gauge whether the numbers and trends we're seeing are real or not. That means we have a 91% probability or chance that what we're doing is in fact working and decreasing the virus load in our city. The epidemic is declining. 22 less infections today in the last 14 hours. Let's look at the first chart that Dr. Myers has. This is similar to the chart that Dr. Escott presented to us. And you can see this has the 7-day running average. The dots, the green dots, are the actual numbers. You can see that Dr. Myers does this chart early in the day, I think, is reflecting yesterday's numbers. So that last green dot, which is the most recent number, reflects the 43. That was yesterday's number, not the 57 that is today's number. So there's a 1-day lag for these charts. But you can see that the green line in the middle, the mean line, is now suggesting a downward trend. The gray lines, the spaghetti lines that are underneath the mark there, show you what the future possibilities are, and there are, most of the lines now are indicating some kind of downward trend. Not all of them. There are still some possibilities could have us increasing, but that's a good chart for us to see. That takes us out through August 16th. The next chart, same kind of thing, but now it talks about total hospitalizations, not just hospitalizations for the day. Same kind of pattern that we're seeing. Remember, we were scared that on the trajectory we were on before, the trajectory between June 7th and July 5th, when that's going up, you can see how quickly we moved in that period of time from 100 to 500. If we had stayed on that, we would have gone from 500 to 1,500 real rapidly. And at 1,500, we have exhausted our beds. That could have happened within just a couple weeks, few weeks, had we not changed the trajectory we were on. Let's go to the next chart. Same kind of chart, but with respect to ICUs. Even though it's a trailing indicator, now we've done this long enough that it looks like even ICU number may be going down. Next chart. This is the chart that graphs the R naught number. The line going across is 1. We're trying to stay below 1. If we stay below 1, then the amount of infectivity in our community is going to continue to drop. The numbers that we don't see yet that I hope we're going to start seeing and put on the dashboard is our infectivity percentage in our community. We have lots of different people that are giving tests in our community, and they don't, there's no law that says they have to report back to us. So we're using our orders to try to make that happen so that we can report to the community in total the number of tests that drugstores are giving, the pharmacies are giving, that community care is giving, we're giving, everybody's giving, the clinics, the hospitals, so that we can then see how many people actually are found to be infected with the virus. That will give us a percentage of people that are positive. We might be able to get a feel for what the infection rate is in our community. I'm told we're getting really close to being able to have that number, being able to present it. That's the virus load that we are trying to drop down. So those are the numbers. I want to answer some questions that have been asked, but before we do, I want to ask a question of you. It's clear that this community can really rally behind doing what we need to do when the community is faced with the fear of what happens if we continue on the direction that we're heading. Back in March and April, we were watching what was happening in New York. We were scared. We didn't want that to happen here, and that motivated everybody to really do a really good job so that we could drive the virus down, stop it from really happening here. May, the weather got good, people out playing outside, not very many people wearing masks, people gathering in larger groups. Numbers started going up. I started trying to urge everybody to wear masks. Frankly, it didn't work. The number continued to go up until we started having emergency room physicians and others go to the community and say, and have our governor say, that it's gotten now to such a point of crisis that unless we do better, we're going to overrun our ICUs and overrun our hospitals. And with that, and we see that happening right now in the valley, by the way, where they don't have room in their hospitals right now. And the numbers are continuing to go up down in the valley. But here in this city, when we were confronted with that fear, the fear that was in those physicians' eyes was real. The community got together again, and people are now wearing masks and avoiding large groups, and the numbers are turning. The question that I have, and I don't know the answer to it, how do you keep a community motivated to continue to wear masks, to social distance, to try to avoid large groups? How do you get a community motivated to do that when the goal is to drive the virus load down so that we have a better way of sustaining businesses and keeping them open, so that we have a better chance of keeping schools open in a sustained kind of way, when we're not making people afraid of what happens if they're not conscientious and so disciplined, but when there's just a benefit associated from doing well this work that we have to do. Because I'm not convinced that it's the same motivation. And when you look at cities around the country, there are a lot of cities that faced with rising trajectories were able to do what it took to get the trajectories to go down. But I haven't seen the city in this country that's able to really maintain it at a low level. As people start trying to open up their economy and go back to normal lives, the numbers start coming back up again. And you have cities then that are pulling back on opening up the economy, all the way to Los Angeles, which could be the first major city to actually do a second shutdown. I hope they don't, because now they're facing the same fear. But if people have suggestions on what it would take for our community to actually sustain doing well, when doing well just means good things and not the avoidance of scary things, I would take that assistance and that help. Jill asks, are community athletic centers exempt from the mask mandates? I understand the schools have to follow the UIL rules, but I've witnessed youth training programs where kids are not 6 feet apart, working out and running drills with no mask. Is this legal? Well, the answer is that under the orders that we have put here, all persons under 10 years or older have to wear a face mask when they're inside a building or a space open to the public, or when they're in an outdoor space and it's not feasible to maintain 6 foot of social distancing unless they're involved in a physical activity. If they're involved in a physical activity, then the requirement to wear the mask is not the same. Part of that is the governor's order. Part of that is now the state rules that are coming out by UIL as they're letting teams work out and practice. And at this point, we're not forcing that issue. If we start seeing clusters and the like, maybe we do. But as UIL had teams that were coming back for summer practice and they saw that the infectivity was so high in the community, they had teams that were getting more and more infections. They pulled that down themselves. Let's see what happens here in the fall. UIL has indicated today that they're going to let teams start doing weight training here initially, like gyms are open in our city now. Then the teams can practice after Labor Day, big schools in October. For me, given where we are now with our numbers going down, I am less concerned about teams practicing, although I am concerned about it, and we're going to have to watch that because I think that there's a significant risk that people will show up to those teams, have the virus, and the virus will spread. But maybe if it's a small enough group, they can notice it and contain it and isolate it before it spreads too far. I am concerned about games. I'm concerned about large groups gathering in stadiums because you really can't control the virus. Our ability to be able to have large groups like that in stadiums or otherwise totally dependent on our ability to be able to drive down the virus to a much lower level than we're at right now, which is why we all need to be wearing our masks and doing everything we can to continue to drive down that number. But that's my concern. My concern is with people that want to go watch and crowds that gather. Nancy Gonzalez and others asks, why are the number of new cases going down? Is it a question we just have insufficient tests? There are prolonged periods until test results return. Is that what it is? I know it's not that less people are testing positive. I noticed it last week. It went from like 700 to 100 count in 1 week. She says, I know not to trust most of the news about falsifying numbers since they no longer need to be reported to the CDC. But I was really hoping that I could trust Austin's government's numbers anyway. Well, there are two answers to that question. The first one is I share the same doubt with you or predictability with cases, because as we just saw, you have numbers that go down on a weekend and they go up as the week begins to start. Case numbers change as you offer more and more tests. You're going to get more and more cases that are identified, all other things being equal. Our case numbers were going up before, not because we were offering more tests, because the number of new cases were going up 3 times faster than the number of tests were going up. But very early in this process, we anticipated this issue with tracking our performance based on cases, and that's why we track hospitalizations, because hospitalizations aren't dependent on the number of tests you give. They're not dependent on who we give test results to or report them to. People show up at the hospital when they get sick, and they just show up at the hospital. And if we count the number of people that go to the hospital, that's about as objective a number as we can get. It's not dependent on anything else other than people are getting sick. And as more and more people get that sick in our community, more and more people show up at the hospital. But that's why we moved to that number. And I think we have found it with our modeling to be a very reliable number for us to be able to do planning on. I told you back in June, I told you back in May, that we were not necessarily in control of how fast the economy would open or when it would open or what events were allowed under the governor's order or not allowed under the governor's order. But what I told you was because of the information that we had in March and April, we could develop models so that if we saw any red flags as trajectories were rising, we would be able to tell you in time for you to be able to change the behaviors as a community and stop us from overwhelming our hospitals. And that's what we saw happen. We set out our models, we got to our triggers, we set out the alarm, you all reacted, and it was early enough for us to be able to change the trajectory in a way before we overran our hospitals. We are not out of the woods, can't take your foot off the brake. Things could still change on a dime. But thus far, we're doing good. But that's why we focus on hospitalizations. Lots of people have asked questions about local testing capacity. Right now, we're testing people that have symptoms. Frankly, we don't have enough tests to test everybody in the community that wants to be tested. We have enough tests to test everybody who's symptomatic. If you have symptoms, go to your doctor, go to your clinic. If you don't have insurance, sign up on the Austin Public Health site, Community Care, and get tested. The federal government is trying to decide now whether or not to provide more money for states and for cities to do testing. I understand there's some people that want to cut off that funding. That would be horrible and disastrous if that happened. The testing that we're able to do, even though it's limited right now, unfortunately, to just people who are symptomatic, is funded. with the federal dollars that we get. So I hope and trust that that's going to continue. You all should be reaching out to your congressional delegation and to our senators to keep money flowing to cities so that they can keep providing basic services and the health system that we have in the city. But not having tests and not having labs that can turn around tests is not something that we're facing just in Austin. It's something that's being faced by cities across the country. I also got asked a question. Austin Economic Development Department, at City Council's direction, has a program to get funding for child care centers. A lot of child care centers have really been hurt because of this, as you might imagine. It's a really important infrastructure in our city. There's a real fear that if the child care companies that are living on such an edge are not helped through this period of time, then when we come out of it, we won't have any child care facilities in our city, which would be pretty disastrous. We set out rules that said, as a city council, that the child care centers that were eligible to get funding were those that had state certification. As it turns out, there are a lot of good child care centers that are hanging on by an edge that have applied for or are seeking certification. So we've made it now that child care centers that either have the certification or a child care center that initiates and begins seeking a certification, also eligible for the funding. And I want to make sure that everybody knows that so that they apply for the funding. Finally, I got asked the question and continue to get asked the question about protests, and are we seeing infections from protests that occurred at the beginning of June? And the answer to that is no. We're not seeing those. And when I give that answer to some people think that I'm giving a political answer, and I'm not. But it's important for us to analyze that information and data, like all that we get, so that we learn. All right, so we're not seeing clusters develop from people who participated in the protests, unlike the clusters that we're seeing at construction activity or among healthcare workers or the other places that we have seen things, families, clusters when people who have the illness go home and then their family catches it. So what do we learn from that? Because we should be trying to learn from everything that we do. Why is it that we're not seeing the kinds of confirmed cases that we might have seen? And when I talk to the experts, what the experts tell me is that it may be that most everybody at the protests were wearing masks, which happens to be true. It's also true that the people at the protests were not spending all their time next to one other person. They were moving around. They were with lots of other people. And some of the evidence now suggests that in order to be infected by somebody, it's not a question of just passing them or being with them just for a few moments. It's actually being with them for an extended period of time, maybe for a few minutes before that person can infect you. And the last thing about the protests is they were outside. So when we take a look at the three key cardinal factors for passing the infection, it's the PPT standards. It is proximity, protection, and time. How close were you to the person who was infected? Did you have masking or other kinds of protections, or did that person have masking or other kinds of protection so as to not infect you? And the question of time. PPT. Proximity, protection, and time. That, I think, is the lesson that we see. And that's an important lesson to learn, because we can then apply that lesson to how it is that we need to open up businesses. We can apply that lesson to how we operate schools. If we're trying to open up schools, we need to learn by these lessons, because this virus is going to be with us for a while, and we need to adjust to it. All right, I'm going to conclude the program. I run out of words sometimes to describe how much I love the pictures that kids send me to be on this little thing that we do. But I'll never stop being reminded and reminding you that kids are teaching us a lot about resiliency and rediscovering even the kinds of things that are with us all the time around our homes. I'm going to introduce you tonight to Liliana. She's 5 years old. She has planted her own flower garden, which is absolutely beautiful. While we're trying to figure out how to educate our kids, they just absolutely do not stop learning. This picture is beautiful. The flowers are beautiful. Liliana is beautiful. And I want to thank her for sending me this picture. With that, I want to say good night. Y'all take care and be safe.